thank you first, for giving us your time to have this chat about infection prevention and control. Appreciate it. So we've been doing these small podcasts with relation to healthcare for a while. And Ms. Cutler, what I would like to share is it's always been men I have spoken to. So it's an honor and a privilege that I have a woman today, a lady to speak with. So appreciate your time and, thank you for agreeing to doing this small chat with us. I'm excited
it's my
for
pleasure
that.
and my honor. Thank you.
Thank you, Ms. Cutler. So I believe, you have been a consultant in infection prevention and control. You have over 40 years of experience. Your educational background belongs to both biology and nursing. You have numerous awards and publications and presentations under your belt. And, after being affiliated with hospitals, you're now the president and CEO of Chicago Infection Control. For the benefit of our readers, can you tell us how your journey has been for the last 40 years?
It's been a wonderful journey. I always tell my colleagues there's never a dull day. You can have a to-do list and sometimes you have to throw it out the window because a new epidemic starts. And so you never quite know what your day is going to be. But I've loved the learning, I've loved the progress, and I've loved the improvement that I hope I've given to patients over the years.
Absolutely. That's such a joy to hear. I'm sure with, over 40 years under your belt, you have many stories to share and many learnings that you can share with us today. So, to begin with, I would love to ask you, what according to you are the core principles of infection prevention and control that all hospitals across the globe must adhere to?
Well, patients, when they come to the hospital, are sick with whatever condition brought them there in the first place. And my goal, as it is with other infection preventionists, is to make sure they don't get sicker once they get to the hospital. They deserve to have whatever issue brought them there treated and go home or to their next level of care better than when they first entered the hospital. Unfortunately, I've seen many times where they develop an infection in the hospital and it leads to a longer visit, a longer stay, and sometimes bad outcomes. And so my goal, my entire career, is to make sure that they don't leave any sicker and that they get better.
Wonderful. What would you say are some of the most common misconceptions about infection control in hospital setting that could lead to safety lapses?
I think the most common misconception is that applying the rules and regulations is optional, that we can do it if we have time or if we feel like it, that we can make our own decisions. I understand emergency situations. Yes, you don't maybe put on your gloves and your mask, but those are few and far between. And so following the personal protective equipment, the vaccinations, and the rules and regs are the way to protect us and the patients.
Right. And do you think that, usually because of small lapses, situations are created which could have easily been avoided?
Yes, I do. I think people forget to wash their hands, something as simple as using a sanitizer or soap and water. They forget to either put on their gloves or remove their gloves. When a patient's coughing, they forget that they probably should wear a mask. We don't know what everybody has when they walk in the emergency room, so putting on a mask makes sense. And I've been preaching those basic principles, we call them standard precautions, for 40 years. And some people get it, some people don't.
And you're at it, making sure that people do follow those basic protocols. All right.
Correct.
So do you think that, infection control practices, let's say, would differ in different healthcare settings, let's say from clinics or nursing homes or hospitals, or are they all, leveled out flat, or do they differ according to the clinical setting?
I think a lot of them are very similar. The patients in the hospitals are sometimes more immunocompromised, newborns, for example, elderly patients with cancer. So I especially want people to follow the recommendations and regulations in hospitals. Clinic patients and long-term care patients are sometimes a little healthier, whereas, you might not think that they are, but there's still basic precautions to protect the patient because you go from patient to patient, and healthcare workers themselves can have illnesses that they transmit. So the basic precautions, we call them standard for a reason.
Because they are the bare minimum that you would expect to maintain a decent level of
Absolutely.
infection control. All right. So, since you work for so many years with hospitals, what do you think are the biggest challenges a hospital faces in implementing infection control measures, particularly if we talk about, if you have limited resource environments?
Sometimes hiring someone with my background is a problem that hospitals face. In my last hospital, I was an interim director because they couldn't find anyone during COVID with enough experience to come to an 800-bed hospital and just lead the department. They had frontline infection preventionists that were quite new and they were petrified. And so bringing me in was something that helped everybody settle down and realize, yes, this is a pandemic, but we can survive and we can make patients stay as healthy as possible, and healthcare workers too.
All right. So would you say that, one of the bigger challenges is to find a relevant person who has the relevant experience and can lead the way in a dire situation?
Yes, and the way I got into it years ago was the nurse who had the job in my little hospital where I started was a former operating room nurse, and she had arthritis and couldn't stand by the patient's surgical bed anymore and hand the instruments to the doctor. So they gave her this job. She didn't know what it was, and I was working there as a new employee with my biology background, and she came to me and she said, "This would be a perfect role for you if you go and become a nurse." So I did, and then she retired and I took her job. So, it takes somebody who understands transmission and basic biology to fulfill this role, either a nurse, a microbiologist, a public health person, but there's fewer of us that are seasoned, as we like to call it now.
True, and that brings me to my next question, that we have seen a recent global health crisis, right? So how have infection prevention strategies in hospitals evolved over the last decade, especially in response to the recent COVID health crisis that we had?
Well, here in the United States, we mandated vaccinations for healthcare workers against COVID. And that was something that we did to protect both them and the other patients that those healthcare workers would see. That served us well once the vaccine came out. But unfortunately, there are people here in the United States and probably elsewhere who don't like mandates. They think it's my body, I can do with my body what I feel like it. But in healthcare, we have a duty to realize we're not just protecting ourselves, we're protecting the vulnerable people we take care of. So the mandate to me was the right thing to do. Unfortunately, we lost some healthcare workers who said, I'm not going to be required to do anything. So that was kind of thankfully not terribly a big problem, but it was a problem. People don't like mandates.
True. I was even thinking it's similar in Asian countries as well. And I think in some parts in US as well, where people were against vaccinations. They were very worried about what they're putting in because we had not seen this pandemic before. We did not know what the vaccine would entail. And rather than, protecting themselves, they chose that they would not like to put anything in the body, even if it mandates. And I'm sure globally they've seen, some percentage because of which there were, more transmissions, more deaths. But I think we can't really enforce anything. It was at the end a choice that people made.
Yes. Here I was actually glad we did mandates for healthcare workers because it truly, now that all the studies are done, it truly saved lives. People in, we call them red states and blue states and purple states in the United States.
Yeah.
And people in the red states, the majority of the red states had higher death rates from COVID because a lot of the people decided, and these are just regular people, decided not to get vaccinated. So, in retrospect, the vaccine was the right thing to save lives.
Absolutely. I agree because I personally have been vaccinated, I think twice, and with a booster shot. And
yes.
I think it's, and most of my family has been, and it served us well. So
there's a new variety vaccine coming out this fall. Be sure you get that one because the virus keeps changing. A virus just wants to live. I tell my friends and colleagues, the virus keeps changing, so it can transmit from you to me. And so it always changes a little bit, and then we have to have a new vaccine.
Absolutely. So I've heard of the new vaccine because some of my colleagues work out in the US, and some of their known folks were getting a variant of COVID right now. And I said, oh, I thought it had gone. He says, no, it's not. It's coming back in a much milder form, but it was there. And
Right.
I don't recollect the name of the new vaccine, but he did say that the doctors, might prescribe it maybe 6 months down the line.
Actually, here it's probably going to roll out in late August and early September, and I'm going to be traveling on vacation, so I'll be at various airports and with people on an airplane. I'm going to get it because I'm elderly myself, and so I just want to protect myself and the people I love.
Absolutely. That makes so much sense, complete sense. So moving along, with the perspective of infection prevention, how do you think COVID pandemic differed from, the past pandemics, let's say the H1N1 or the SARS, in terms of its impact on infection control protocols? How was it different?
I think the news media loves pandemics or epidemics because I've heard the phrase, if it bleeds, it leads. In other words, it hits the news. You can turn on your TV or read your newspaper or look at whatever social media, and things like pandemics or epidemics scare people. So that's something that makes you pay attention. Unfortunately, some people don't react well, and they kind of shut down and they don't listen to the science. They just are so afraid that some people I heard have been locked in their house for 4 years. They're so afraid of COVID. So people either go one end or the other, and it's hard for them to find the middle. With H1N1, there was a lot of fear, especially when we heard in the United States that young people in Mexico were dying of H1N1. And the thinking of my infectious disease colleagues was, oh, this could be the next influenza pandemic because H1N1 is a form of influenza. It turns out that it did cause some problems, and it did hit pregnant women and young people because elderly people who were willing to get the vaccine once it came out were kind of immune or had partial immunity to that pandemic to H1N1 because they had been infected with something many, many years ago, and their body remembered that they had had exposure and developed its own immunity. So that was an unusual pandemic, but the fear is always constant.
Yeah, of anything new and unknown, especially where you're not aware how it's going to affect you. True.
Correct.
So, so did the response strategies of hospitals evolve compared to those used during previous outbreaks? What new practices have been adopted as a result of the COVID?
Because of COVID, I think mandating use of personal protective equipment is not considered so startling anymore. I mean, if we had another pandemic and people said, if we put a sign on the door, it wouldn't be an optional kind of thing. Well, it says you should wear a mask and a gown, but I don't feel like it, and we would stop each other in COVID. We would have someone monitoring whether the healthcare worker was appropriately gowned and masked and gloved before the healthcare worker would go in the room. And so having people take accountability for what they do and what their peers do, even if it's the top surgeon in the hospital, a nurse or a EVS worker, environmental service worker, could say, doctor, I'll tie your gown for you because your gown is going to fall off if you don't tie it behind your neck. So I think we've become braver and less worried about positions in healthcare and ability to speak up for safety.
Great. Yeah. And I think it is important to do that. Especially self-monitor, because there is only so much that the government of the country can do. If we don't stop people or say that it's not acceptable, especially in public places, I think the more we self-monitor, it's going to be better for everyone else.
Yes. Yes. And the last big hospital I worked in, we even put in an electronic hand hygiene monitoring system where we had a badge holder that had electronic parts to it and it would know that Connie is entering this room and she was not close enough to use the soap or the hand hygiene or the sanitizer. So it would say, oh, she forgot. And so she did not provide good sanitation before she went in the room, because most of the time people remember on the way out. They want to protect themselves, but they forget that they've just come from another patient's room and they have to use hand hygiene before they go into the next patient's room. So that has been a wonderful system. It's not cheap, but it is effective because we feed back the data to the healthcare worker so that they can monitor their own use of hand hygiene.
Right. So it kind of reminds them, if they had 10 patient visits, they have missed their hand sanitizer in 2 or, something like that. So they're more self-aware when they doing their next rounds probably.
Yep. It was very effective, and I'm very proud that we spent the money to do so.
Absolutely. So, how, according to you, can the hospital staff as well as the patients contribute to infection prevention beyond standard protocols? What would you say are some of the best practices for fostering culture of safety?
I think we need to encourage our patients and their families to speak up for their loved one or themselves. If I were in a patient's bed, if I were a patient and I saw a healthcare worker come in and not use hand hygiene or not show me that he or she is like doing this when they walk in, I would say, do you mind using the sanitizer that's right there on the wall, or the soap and water? And people are still afraid, patients are afraid it might somehow affect their care if they confront their healthcare worker and they might be labeled as a difficult patient or something. I think we need to get past that and realize that it's for the safety of everyone.
True. Makes sense. And moving towards the last question, as we move forward, what do you think are, some of the emerging trends or innovations in infection prevention control that hospitals should be excited about, and how do you think they'll shape the future of healthcare?
Well, the one I mentioned about the electronic hand hygiene, I think only 5% of hospitals have that. So I would certainly put that as an emerging trend. I also think just understanding that a pandemic or an epidemic or just a simple infection can start by missing an important little step in either the requirements or the recommendations. So educating our healthcare workers to make sure that they understand that their role is crucial in preventing infections. I can do everything I want to behind the scenes, but I'm not the one touching the patient. So having healthcare workers understand their role and having patients contribute to the whole process, I think will make the whole world safer.
Absolutely, and I agree with you. So, do you think the adoption is only 5% majorly because of the price element, or there could be other reasons as well?
Some of it is price. Other of it is that some people feel like Big Brother is watching them and that they don't want anyone to know when they went on break or went to the cafeteria. So my system chose a product after looking at 6 of them that were out there that would not track them. It would only know when they're going in and out of the patient's room. So if they went on break, it wouldn't say, oh, you spent 20 minutes on break instead of 15 minutes. So we had to get past that Big Brother is watching you kind of worry. And we were able to teach them that it only tracked what they did while they were on their unit. And so the acceptance has been very high.
Great. So, in the future, we can expect more and more hospitals to adopt this. While I was reading up on the matter, I also read about antimicrobial textiles and some ultraviolet C devices. Do you think they will gain acceptance or, higher adoption in the future as well?
Did you talk about antimicrobial stewardship? Is that what you said?
Yes, antimicrobial textiles, so fabrics that are...
Oh, textiles. Got it.
Textiles, yeah.
I do think that there's a lot of opportunity for textiles, surfaces that have maybe silver coating or copper coating. I've been reading about copper and its antimicrobial effects. I do think the hospital of the future, maybe 20 years from now, if I'm lucky, will be built with all of these things in mind. Healthcare workers will wear scrubs that have the textiles in them, and the surfaces will be covered with copper. And so it won't be as easy for microbes to find their little niche to live in.
Sounds good. Let's hope for a, infection-free future really soon.
Yes, that is my goal. Because someday all of us will probably be in the hospital.
At one point or the other. True that.
Exactly.
Yeah. So it's been such a pleasure speaking with you, Ms. Cutler. Thank you so much for your time. Before I let you go, did you have anything to ask of me?
Tell me a little bit about infection prevention in your country. I'd love to hear about that.
Absolutely. So, most of the protocols that you did say happen here as well. COVID especially, I think, changed the landscape for us. I think the sales of hand sanitizers just rocketed. I think every household, every nook and cranny had gallons and gallons of sanitizer at that point in time. We didn't understand whether it's going to save us or not, but we didn't have a lot of options. So we were trying to use or, follow protocol as much as possible. Infection control is a big issue because of the population that our country has. And I think considering that, we fared really well for ourselves. In terms of getting the whole population immunized, we had a smart card. We didn't have paper, it was just everything was done on mobile devices. You have your the fact that you have got immunized and how many shots you have is all on a record. And entries and exits into public places were based on whether you could show your proof that you've been vaccinated.
Yes.
And all this happened overnight because even this tech part of it, I think it's amazing, really.
I do too.
That they could manage.
And I'm hoping that the learnings we take from COVID will survive into the future so that when the next pandemic comes, and it will,
we will be much better prepared. Amen to that. Yes. Thank you so much, Connie. Have a great rest of the day. Bye-bye. Same here. Me too. Likewise. Bye-bye.